Hi, my name is Fran Spreer-Albert, and I am sitting in for Dr. Dennis McKenna today, who is taking some very well-deserved time with his family. As our guest today, very happy to introduce Mr. Mitch Amato, and he is the Chief Financial Officer of our Glens Falls campus. Hello, Mitch.
Hello, Fran. Thank you for having me here today.
Very happy to have you
pleased to be here. Thank you.
So Mitch, as you would imagine, has a very strong finance background like myself. And I thought we'd start by talking about, what drew you to healthcare? So many times people ask me, with the skill set I have, why did you end up working in a healthcare institution, and how did you come to love healthcare so much? Well, so maybe you could tell us a little bit about your journey.
Absolutely. 30-something plus years later, it's still in healthcare. And my first job was at Blue Cross in Utica. And I didn't know what I was getting into, but I was actually doing Medicare audits. And I found that more interesting and challenging than any course I ever took. Really trying to figure things out, trying to make sense of it. So I sort of gravitated toward it, trying to figure out the puzzle. And as I became more acclimated to it and understood the industry better, I saw a lot of folks got their hospital background from Blue Cross and Medicare. And as time went on and I met other people in the industry that were working in hospitals, I said, it would be pretty nice to work in a hospital. Try to be on the other side than the audit side. And be careful what you wish for, okay? Definitely much different, but very rewarding. And it's still sometimes a puzzle to this day. It's very important to our communities and to our patients. What we really are creating is value and access, and you see the patients every day. Many of my colleagues were in banking and real estate and the market, a lot of other things. And, a lot different, but I always felt happy to know we were creating a product that people had access to and made a real big important in a lot of people's lives. And I've been mostly in community hospitals. Happy to be affiliated with Albany now. Community medicine, community is very different than academic and tertiary, but having them both combined is very important. So the numbers are challenging, but my passion for healthcare is really what drove me to it and kept me there. So.
Fantastic. And maybe, Mitch, we can talk a little bit about the importance of collaboration between people like you who have strong finance skills and clinical leaders who know all the things that have to happen in order to make our patients get the best service. But why is it so important that we work well together?
Ultimately for the patient. And I'll tell you why. And I learned this over time. They're so smart clinically. Why can't they figure out this with their budget? Why can't they figure this out financially? And you learn and learn and learn more as time goes on. But the real eye-opener, the most extreme eye-opener to me was my daughter's a PA. All right? She can solve any organic chemistry problem in the world. She can do it. And she will spend time with the patient, and she gets it. Depreciation, interest rates, that's not on their radar when they go to work. It's not. And that's their wheelhouse, and that's what's important. So what we have done over time is try to bridge that, understand the value and the importance of what a clinician brings, and how we can become a partner with the clinicians to make their experience better and provide more resources to make their patient experience better, and provide more resources and education to bring more finances to the mission. But they go to work, I go to work, Fran goes to work, we think about cash, patient volume. They're going to work, what's my schedule today? What am I doing? And that, having them focused on that is great. And financial professionals and teams to provide a bridge is where we can really make it happen in a non-intimidating factor, but also get a lot of respect for what they do every day and what they're faced with.
And the way you express that, I really like, bringing cash and bringing value to the mission. At the end of the day, at the beginning of the day, at the middle of the day, the mission is our #1 priority. But the financial integrity and financial strength of our organization is so important. So unlike our colleagues who went into banking And many of those are public institutions where you're very focused on earnings per share. You're trying to please those shareholders. In our case, what we're trying to help our clinical leaders do is maintain a very sound, growing, viable, thriving healthcare institution to serve our communities for many, many years to come, long after we fulfill our services at this institution.
Exactly.
And trying to help all of the leaders understand that. It's a delicate balance.
It's access and quality. I try to simplify it. Giving the access to the communities that they need in a high quality manner. If you compromise needed access and you compromise quality, I don't care how financially strong you are, you don't have a good product. And I know our affiliation is helping us better, meet our mission, not compromising access, improve our quality, collaborate together, and it's I feel energized by it all the time.
Yeah, I do too.
I do, because there's a lot of opportunity and there's a lot of good people. We may have disagreements, but we're all fighting for what we believe our communities need. And I think one of our bigger challenges we all have to get over is through the affiliation, our community has grown to all 4 affiliates. It's not just one. So that will transition over time. But I think that's a good way to look at it.
So Mitch, you and your team have been outstanding partners to us in this affiliation journey that we've entered together and we progress on every single day. And you said it best, collectively, our community, our services have improved and have grown, and that is the goal, that trajectory will continue well into the future. You've worked downstate. Yep. And for systems that are larger than ours, what do you see as different in the upstate dynamic and the upstate service model than downstate New York?
That's a great question, and part of it's very easy for me to answer. The upstate work ethic is unbelievable. I grew up in Utica, New York. My father was a fireman. We had 5 kids. We never complained. We were happy to, the lights were on, we went home. It wasn't that bad, but, we were very appreciative of what we had and how hard our parents worked. And upstate New York has a great work ethic. And downstate, they like to hang their diplomas. I'm not being critical. Yeah, it's a little different. It's a little different of what they feel comfortable with. And I think folks upstate New York and almost any business feel comfortable with the outcomes they've provided to the communities they're in. So strong work ethics, and I think the community, and we are true community hospitals. Albany Med is huge, but it's a community hospital.
Absolutely.
And
Absolutely.
I really think that deep down, not even deep down, the communities understand the value of what it brings. And
you bring up such a really, really important point about the cultural differences between different regions. So culturally, our regions, upstate New York, very similar to one another. And that is one of the reasons that we are so focused upon building our system and maintaining our local governance, maintaining our local control, because we understand the culture of our communities and the needs of our communities better than anyone.
And I did, not a lot of soul searching. When I left downstate, I was in a good spot to make a decision of where I wanted to go and what environment I wanted to be in. And it really came down to what makes a difference. And downstate's different. They have some great organizations. They provide great care, world class, but it wasn't the right fit for me. And I'm so happy to be back. 10 years flew by already, but it's good. And now this next level of integration and collaboration and partnership really is good.
So Mitch, one thing you and I have in common, and there's many, but one thing you and I have in common is our belief in team.
Yes.
And building our team for today, building our team for the future, and kind of cross-pollinating all of our teams. Can you talk a little bit about your leadership style, how you recruit, and how you retain, even more importantly, your important team members?
Well, first of all, I believe the resume doesn't tell the whole story. You have to have someone who's genuine, and you can usually, filter that out in an interview. And you want someone who you believe is invested for the long run in a leadership role. But most importantly, you need to provide, once you hire that person, give them the opportunity to do so. You can't micromanage. You need to understand if they need to be micromanaged or they like managing from a distance. Give them their own autonomy, but guide them along the way. Because this is only my second real, I would say, long CFO job. I've had a couple. That's it. And if you have constant turnover, and I don't care what business, you cannot have a good product. And I've been here 10 years now. Fran's been here many years now. And I'm
22.
22. And I stress to our future leaders, you need to build good teams and you need to have continuity. I look at retention. If one of my managers, not my managers, one of our managers does not have a good retention rate, but their work product is good, what's going on? So retention is big. And giving your leaders the opportunity to, make their mistakes, own their mistakes, but collaborate on, how to move forward. But it's building future leaders is key.
And I want to compliment you. Have had lots of opportunities to work with you and your team. Your team is highly competent, highly professional, and incredibly collaborative, and have been an absolute pleasure to do work with.
And a compliment to you and your team, the way they just gelled. Initially, human nature, everybody wants to put their territory out there. And sometimes that lasts in an unhealthy way. And that's human nature. And both teams have integrated. It's just amazing how the finance teams have integrated. And coming up yesterday, like, we're out of the picture. We're on the sidelines. And to see the teams go out there and lead the integration of, yesterday was the ERP. These are the future leaders that, we're helping them build a product and build the teams. Something like yesterday, you just see Michelle up there, you see Craig up there, you're seeing future leaders really building, confidence.
It was a very happy and exciting moment for our future.
Exactly, yeah.
So, Mitch, I wanted to talk a little bit with you and others just about all the things that March means to so many people. And I'm only going to mention a sample. But March is the national month for those with developmental disabilities. It's Women's History Month, Colorectal Cancer Month. Of course, you have St. Patrick's Day and lots of other Irish celebrations during the month of March. And March Madness as well. And again, as I said, only to name a few. But wanted to talk about it's National Optimism Month as well, which is very important to me, and I know you're a very optimistic person as well. Wanted to talk very, very briefly about one person who kind of grabs a lot of those themes. So her name is Sinead Byrne. I don't know if you've ever heard of her or not. But she is a activist with respect to individuals with developmental disabilities. She refers to herself as a small person, and she's from Ireland, lives in Dublin, and is also a wonderful writer and a wonderful optimist. But one comment from her that I think creates a lot of discussion, a lot of thoughts, is her greatest challenge is not because I'm a little person, but because of exclusion. And exclusion due to the design of our physical environment and due to societal assumptions. And I know one of the things that we are very focused on across our entire system is inclusion, and inclusion for everyone. And I know you have certainly championed that day in, day out, and thank you for that.
I think that you learn a lot. And again, I was fortunate enough to grow up how I did and where I did. And it was inclusion, more than I've ever, it was sort of ingrained. We didn't have to learn much, we lived it every day. And a lot of good things came from it. And, I just sometimes think that we lose track of it. And it's more natural than people think. It's more natural than people think, and a lot of respect and happiness and debating, but that's what inclusion does. And we learned from a young age. We didn't learn; it was just
part of your culture.
Yeah, and I think some individuals, some organizations have never had that experience growing up, and I don't think they're against it. I think they might have some. They're not comfortable along the way, so. We need to support them to becoming more comfortable with it. Oh, it's good.
So, and one last quote from my grandfather Flynn, in the spirit of optimism and tomorrow's holiday, you don't look at it as your glass being half full or half empty. there's room for more in that glass.
I like that. I like that. That's good.
Thank you so
Well,
much
thank you
for
for
being
having me.
here
This was
today.
great. This was great. Really good.
Thank you.
Thank
Thank
you.
you,
Thank
everyone.
you.
And on behalf of Dr. McKenna, take care of you and take care of each other.